A few years ago, our 30-some-year-old son lost his job to technology. Of course, he also lost his health insurance at the same time. He went to get medical insurance, and in his naivete, he said, "I have Asperger's syndrome." Oops! Even though he had not been officially identified and had no medical costs associated with this since childhood vaccinations, he was refused insurance by that company and every other company he went to. Instead, he was told, "You can get insurance. Go to the high-risk pool. In November, you can pay $9,000 for it." As an unemployed person, of course, he did not do that. Luckily, in the interim, while he had no medical insurance, he did not get hit by a car or have another catastrophic medical experience. I am a volunteer at a food pantry in Portland, Maine. I can't tell you how many people come to that pantry desperately needing food with similar stories. They tell me a working member of the family has hit a medical situation where they could not continue to work. Therefore, they lost their health insurance, and therefore they had mounting bills until they lost their home and all their savings and had to go live with a relative, or even some of them, on the street. They are in our pantry to get some food. Some medical needs are not even met because of a lack of insurance, and the person then becomes more ill. And I want to add that some of them say to me, "Don't give me any food, I have to chew. I have no teeth." The Delta dental woman was talking about involving dental insurance. I don't know if it's part of this bill or not, but it should be. Because when I lived in New Zealand, every school had a dental clinic, and every child was seen by a dental hygienist every year. You did not see people in New Zealand with no teeth in their mouth, and therefore, of course, not able to find any job. Mainers care about one another, and we can't do this alone. Providing a few bags of food is a stopgap measure. In no first world country does this happen. Canada did it province by province. I'm hopeful that the United States can do it state by state. Vermont first, Maine second. Wouldn't it be great to be on that list so that when Reed writes his second edition of his book, The Healing of America, we're in there. Please do your part by supporting this legislation. And I want to add one little thing based on what was said earlier. I'm on Medicare, and sir, it's not free.
Thank you very much. Questions at all for Ms. Perley? Thank you very much indeed.